Bismillahirrahmanirrahim. Various antithyroid substances are discussed in this video. Antithyroid substances are compounds that inhibit the production and release of the thyroid hormone. The most well-known antithyroid agents include thiocyanate, propylthiouracil, and high concentration of inorganic iodides. Iodide pump is responsible for iodine trapping, and due to this iodide trapping, the iodine combines with thyroglobulin and the thyroid hormone forms. But the substances thiocyanates and similar ions, for example perchlorate and nitrate ions, they interfere with the thyroid hormone synthesis by competing with iodide for cellular uptake in the thyroid cells. They compete with iodide for uptake by sodium iodide symporter, reducing the entry of the iodide, and the thyroglobulin synthesis is not affected. So thyroglobulin is still produced, and iodination of this thyroglobulin is disturbed. And due to this disturbed iodination, the thyroglobulin is still formed, so its concentration increases while its iodination is blocked. So T3, T4 synthesis is failed. So as the concentration of the thyroid hormone decreases, it will increase the concentration of TSH. It sends the signal that the hormone is not present, and by negative feedback, the anterior pituitary increases the TSH hormone production. This TSH stimulates the thyroid gland excessively, and this excessive stimulation that is unresponsive lead to enlargement of the thyroid gland that is termed as goiter. Pro Propylthiouracil decreases thyroid hormone formation. The propylthiouracil and similar drug like methimazole and carbimazole are antithyroid medications that inhibit the synthesis of thyroid hormone at key enzymatic process. The propylthiouracil, it affects the peroxidase enzyme activity. This peroxidase enzyme activity is inhibited, so it blocks iodination of tyrosine residues on the thyroglobulin. So coupling reaction is also inhibited, and this inhibition prevents combination of monoiodotyrosine to diiodotyrosine that forms T3, and coupling of DIT and DIT that forms thyroxine. Thyroxine is not formed, but the thyroglobulin synthesis occurs and it continues. So T3, T4 content is not there, but thyroglobulin is there. As a result, the T3, T4 concentration decreases while the TSH secretion increases, and there is continuous overstimulation of the thyroid gland by the TSH that leads to hypertrophy and hyperplasia. So it results in enlargement of the thyroid gland that is termed as goiter. So this propylthiouracil, carbimazole, and methimazole, they block the hormone synthesis, not the protein thyroglobulin synthesis. So there is no iodination and no coupling of the hormone, activation of feedback loop. So increased TSH levels that continuously affect the thyroid gland, so goiter is developed or enlarged thyroid gland is developed. The iodide in high concentration, they suppress the activity of the thyroid gland and also decrease the size of the thyroid gland. So the administration of iodide in high concentration, about 100 times of the normal level, lead to temporary suppression of the thyroid gland activity that is also termed as Wolff-Chaikoff effect. The effect of thyroid of the iodide concentration is first, there is iodide trapping that decreases the concentration of iodide, and there is feedback inhibition that reduces the activity of iodide pump. Iodination of the tyronase is also reduced, as the lower iodide uptake means fewer iodinated thyroglobulin molecule. The colloid endocytosis is also inhibited, so follicular cell cannot uptake colloid blocking hormone release. So almost immediately the hormone secretion is suppressed due to blocked endocytosis. So what are the effects on the thyroid? The effects on the thyroid hormone output is that there is sharply decreased thyroid hormone output that occurs within hours. Thyroid gland size is slightly used and slightly decreased size, while the blood supply is decreased. So that decrease in blood supply aid in surgical preparation. So this high iodide concentration are used as preoperative procedure or preoperative preparation for thyroidectomy surgeries, because it reduces the gland vascularity, minimizes the bleeding risk, and temporarily shrinks the thyroid size. So its duration of effect is about 2 to 3 weeks before the gland escapes inhibition. So the high iodide inhibit both synthesis and release of thyroid hormone. Unlike other antithyroid drug, it decreases size of the gland and blood flow. So it is widely used as preoperative measure before thyroidectomy. So there are three main antithyroid drugs. These are thiocyanate, propylthiouracil, and the high or inorganic iodide concentration. The thiocyanates compete with iodide for uptake by the thyroid gland, so it reduces the trapping of the iodide, while propylthiouracil inhibit the enzyme thyroid peroxidase that blocks the oxidation of iodide and also blocks the coupling reaction, while high inorganic iodide concentrations, about 100 times of the normal, they temporarily suppress the thyroid hormone secretion and reduce the glandular vascularity. Thank you for watching this video. If you have any query, please write in the comment box.